Diary of a CEO's Sex Expert. What Women Actually Need to Enjoy Sex spends nearly 2 hours on Dr. Reena Malik's sexual health advice, but its most useful conclusion quietly undermines the title. Desire may fail less because bodies are broken than because modern life gives arousal nowhere to happen. That creates a question the interview never quite asks directly. Does it actually discover something women uniquely need? Or is women the hook for a much broader theory of sex? Because Malik's first serious argument is about phones, stress, novelty, and mental space. That's already bigger than gender. Her strongest explanation is the one that sounds least sensational: arousal needs conditions. She describes erections as requiring a parasympathetic, rest and digest state, and talks about long-term desire becoming responsive rather than magically spontaneous. That is useful because it replaces performance anxiety with a process: attention, safety, stimulation, time. I was much less convinced when that careful physiology expands into a diagnosis of an entire generation. The video moves from people scrolling constantly to dating apps supposedly producing fewer deep connections, mediocre first-time sex, and disengagement. Some of that is plausible, but plausibility isn't the same thing as demonstrating that phones caused the sexual decline being discussed. The discussion of choking is more valuable because it identifies a genuinely uncomfortable mechanism. People can normalize a sexual behavior without particularly wanting it. Malik cites women describing choking as something that has simply become part of sex. That's an important distinction between consent, expectation, and actual pleasure. The prevalence numbers, though, deserve more methodological context than the conversation gives them. Then comes the neatest framework: fuel, strength, environment, and the broader sexual health factors around them. Cardiovascular exercise, sleep, pelvic floor function, and blood flow absolutely belong in this conversation. The problem is how cleanly some effects get packaged. Saying 150 minutes of exercise can produce the same improvement as Viagra is memorable. Without population, severity, and effect size context, it sounds far more interchangeable than a clinical comparison usually is. The teaser exposes the same weakness more dramatically. People having sex weekly supposedly live 49% longer, and every 100 orgasms for men is linked with longer life. Those are irresistible podcast numbers. They're also exactly where viewers should ask about confounding. Healthier people may have more sex. Happier relationships may correlate with both longevity and intimacy. Association can be interesting without becoming a prescription. Where Malik becomes especially effective is when the conversation gets anatomical instead of statistical. The pelvic models, the discussion of clitoral and penile blood flow, pelvic floor function, and arousal turn sex from a moral performance into ordinary physiology. That's educational in the best sense. Less mystique, fewer gender stereotypes, more mechanisms people can actually understand. But watch what gets promoted at the very front: penis traction, 2 centimeters of length, pistachios, and erectile function. Traction research can be clinically meaningful, and nutrition can matter for vascular health, but the teaser compresses all of that into maximum surprise. The evidence hasn't necessarily disappeared, its limitations have. So, does the video finally answer what women actually need? Yes, but not in the way the title implies. Its best answer is that pleasure is contextual. Enough arousal, communication, physical health, knowledge of anatomy, and freedom from scripts you don't enjoy. Those aren't secret female requirements. They're a corrective to the idea that good sex is automatic. That leaves me with a split verdict. The mechanistic explanations are often excellent, and Malik is unusually good at making awkward subjects clinically ordinary. The broad cultural claims are less disciplined, and the headline statistics sometimes do more persuasive work than the evidence described around them. The conclusion is substantially supported, the certainty is not always.